Welcome back. I'm Gail Trauco, and this is Healthcare 911. We're talking about obesity and weight loss today, and joining me are Dr. Christine Ren-Fielding and George Fielding, both from the Department of Bariatric Surgery at NYU. I want to talk more about gastric banding for younger women at pregnancy and outcomes, and how this might be a benefit to someone watching us today.
I think this is a very important topic, Gail. One of the often sort of not thought about side effects of obesity is a reduction in fertility. And so I think the band can play a very important role at the front end and the back end of this. And so the front end is you have a band, you lose weight, and your fertility will increase. And we have had many hundreds of women have a band and then have a baby. And so the second advantage of it is that during the pregnancy, an obese woman will get sick during pregnancy with blood pressure and eclampsia and all this sort of stuff. And we have shown in studies looking at ladies who had a baby when they were heavy and a baby after they had a band, and their second pregnancy was safer. And then the other thing is there's the adjustability of the band both during the pregnancy. So say they get miserable and they're uncomfortable, they got a bit more acid, you can loosen the band. But the coolest thing is after they have the baby, and a lot of girls put weight on, you can tighten the band and you can help lose your baby weight.
Where are women going to get this kind of information? Is it going to be from the obstetrician? Is it going to be their family practitioner if they're talking with them maybe about, family planning down the road? Where are they going to find this information, and what physician may initiate these discussions with a patient?
Well, certainly the obstetrician is the primary source of information. And I think nowadays the obstetrical community does understand that weight loss does improve fertility and the health of the baby. We do receive many referrals from our obstetricians for patients to have bariatric surgery. And then it's up to us to decide with the patient which one they should have. George just mentioned the lap band is a great option for women of childbearing ages. So is a sleeve gastrectomy, so is a gastric bypass. But there are certain things that the female patient needs to discuss with the surgeon as far as what are the effects of those other operations on nutrition for the mother and nutrition for their baby. And typically, if you have a sleeve gastrectomy or a gastric bypass, you have to wait about 12, optimally 18 months before you get pregnant, because the weight loss is so rapid and the nutritional deficiencies can be very real. So you do not want to affect the fetus while the woman is losing weight. And the other thing we've seen is that women who've had a sleeve gastrectomy, they've lost weight and got pregnant. When they gain weight during pregnancy, it's very difficult for them to lose it afterwards.
So we were talking about nutrition post-procedure or prior procedure for any bariatric patient. What are the most common things? A good multivitamin, protein shakes?
Iron.
Iron?
Particularly iron, particularly after the bypass. If you don't take iron, you're going to get sick. It's to a lesser degree after a sleeve, but certainly everyone should just take a multi with iron in it at the very least.
Do you have a nutritionist involved with your Department of Bariatric Surgery to help follow all of your bariatric patients?
Yes, we have several full-time nutritionists that are involved with our patients before and after surgery, and we perform regular blood testing afterwards as well.
So you're following them for nutritional deficiencies, and you go over the lab reports with the patient. Is just a multivitamin that's available at any department store or drugstore okay to take, or do they need to get one from you as a physician that is a prescription multivitamin?
No, I think there's flexibility in the type of the vitamins that you take. Certainly with a lap band, a multivitamin is just fine. But with something like a gastric bypass, there are certain types of vitamins that are more absorbable in the setting of that intestinal bypass that you need to take, and we would then educate our patients on that.
So once a patient's decided to have bariatric surgery or they're planning it, it's a commitment on their part before a procedure, after they have a procedure, and then they need to have a good working relationship with the physician and the support team at the Department of Bariatrics.
I think it's essential. I've mentioned this previously, weight loss after bariatric surgery is a two-way street. The patient's got to turn up, the patient's got to do the best they can to follow the advice they're given, but they also need the physical support from the surgeon, the nutritionist, and they need the emotional support from the whole office to help them along this road, because it's not an easy road always. You know, there are a lot of obstacles to success with this, but I think this two-way street between the patient, the surgeon, and his team leads to the best success with it.
Thank you. This is Gail Trauco, and we'll be back with more Healthcare 911.